Hello, my friends. I am Dr. Ava, a specialist in sexual health and human biology with years of experience helping men protect not just their physical bodies, but their core confidence, their dignity, and their most cherished relationships. Today, we are going to have one of the most open, honest, and perhaps slightly provocative conversations you will find on the internet. This is the kind of question men often whisper in private, search for in incognito browser tabs late at night, or ask with hesitant, lowered eyes in the safety of a clinical exam room. But here, this is a safe and strictly respectful space. This is a place where we discuss intimacy, vitality, and men's health without an ounce of shame. When we bring these quiet questions into the light, we do not just learn. We heal, we connect, and we realize that we are never truly alone in our curiosity. Gentlemen, let me ask you something. Have you ever quietly wondered if it is truly safe to swallow vaginal fluids during oral intimacy? What about the variation in taste or the nuances of the scent? Is it normal? Is it healthy? These are real, valid questions that can directly affect your confidence, your level of closeness, and whether an intimate moment feels joyful or awkward. The truth is that most men do not actually understand the underlying science. Today, I am going to give you the comprehensive answer from a medical, biological, and emotional perspective so that you and your partner can enjoy intimacy without fear, without hesitation, and with a much deeper level of mutual trust. The biological brilliance of the female body. Here is the very first thing I need you to understand. Vaginal fluids are not dirty, they are not toxic, and they are certainly not something to be ashamed of. For healthy, consenting couples, these fluids are generally entirely safe. In fact, they are a masterpiece of biological engineering, carefully designed by the female body to protect delicate mucosal tissues, fight off potential infections, and make the act of intimacy more comfortable and pleasurable for both parties. Yet, so many men carry these heavy, quiet fears. They worry about safety. They worry if a specific taste is strange, or they wonder if something is physically wrong with their partner. The truth is that variation is the standard. Safety is the default for healthy partners, and clear communication makes all the difference in the world. Once you grasp the actual biology at play, you will see that what often feels like a social taboo is actually the brilliance of the human body at work. In my years of clinical practice, I have seen how silent worries about intimacy can slowly chip away at a man's confidence and his sense of masculinity. I have counseled men in their 40s who are rediscovering themselves after a long hiatus, men in their 60s and 70s finding new love later in life, and long-term couples trying to reignite a spark that has dimmed. The pattern is always the same. Once a man truly understands how these fluids work, what is normal, and how to approach the situation with respect, the shame dissolves and the intimacy reaches a new peak. Mistake number 5, viewing fluids as simple moisture. The fifth mistake many men make is thinking that vaginal fluids are just a bit of moisture. This is factually incorrect. Vaginal lubrication is a complex biological cocktail. The Bartholin glands, located near the opening, release a silky fluid specifically to reduce friction. The Skene glands, situated near the urethra, contribute further lubrication and, in some cases, are responsible for female ejaculation. Furthermore, the cervix contributes various types of mucus that change throughout the month. Even outside of the peak fertility years, these secretions serve a purpose. This is not a random occurrence. It is the body preparing the environment for safe and pleasurable engagement. Ignoring this fact is like missing the entire point of nature's design. These fluids are a sign of a healthy, functioning, and aroused system. Mistake number 4, assuming taste and scent indicate a problem. A very common error is assuming that a specific taste or a distinct smell automatically means something is medically wrong. In reality, these fluids naturally vary based on a multitude of factors: diet, hydration levels, daily stress. Fluctuations in hormones and even certain medications can shift the taste and the scent profile significantly. Consuming fruits like pineapple or berries, along with high hydration, often leads to a lighter and fresher profile. Ingredients like garlic, alcohol, or heavy coffee can create a much stronger edge. Around the time of ovulation, fluids are typically more abundant and neutral. Near menstruation, there might be a slight metallic note due to iron content. After menopause, fluids may be less plentiful and slightly more acidic. None of these variations are bad. They are simply markers of individuality. The only time to be concerned is if there is a sudden, sharp, and unpleasant change accompanied by itching, discomfort, or unusual discharge. Most of the time, that is just a simple bacterial imbalance that is easily treatable by a professional. Mistake number 3, disregarding the importance of health status. While we have established that these fluids are mostly composed of water, amino acids, enzymes, glucose, and lactic acid, we must remain grounded in medical reality. These fluids are protective, but like any other bodily fluid, such as semen or blood, they can also act as carriers for infections. This includes conditions like chlamydia, gonorrhea, herpes, or even HIV. The mistake is assuming that it is always 100% safe without knowing the facts. The truth is that safety depends entirely on health status. This is why having a conversation about testing and current health is not unromantic. It is actually the most solid foundation of trust you can build with a partner. If you want the freedom to explore intimacy fully, you must first have the clarity of health. Before we continue, if you have found this helpful so far, consider liking the video, subscribing to the channel, and sharing it with someone who may benefit. Mistake number 2, avoiding the necessary testing conversation. One of the biggest barriers men face is the internal fear of asking the question, "Have you been tested recently? And should we go get a screening together?" I once had a patient in his 60s who was absolutely terrified after an intimate encounter with a new partner. Because he had slightly bleeding gums at the time, he feared he had contracted a serious illness. While the risk of transmission from oral intimacy is statistically low, it is never zero. When he finally sat down with his partner and they went to get tested together, they discovered they were both negative. That shared experience actually made them more open, more honest, and far closer than they had ever been before. The lesson here is clear. Prioritizing safety does not destroy the romance. It creates the security required for the romance to truly flourish. Mistake number 1, choosing shame over acceptance. This is by far the most damaging mistake a man can make in the bedroom. If something smells different than usual or tastes a bit stronger on a particular day, many men react by recoiling, making a poorly timed joke, or offering a criticism. When you do this, your partner immediately feels a wave of shame, and the emotional gateway to intimacy shuts down instantly. Instead, the expert approach is to respond with genuine kindness. You might suggest a refreshing shower together as part of the foreplay, or simply encourage more hydration for both of you as a healthy habit. Make it a team effort. Emotional acceptance is significantly more arousing than physical technique. When a woman feels fully accepted in her most natural state, her arousal deepens, her trust expands, and the experience becomes exponentially more powerful for both of you. Acceptance is the ultimate aphrodisiac, the path to safe and rewarding intimacy. If you want to make your intimate life both medically safe and deeply rewarding, follow these 4 pillars of practice. Talk openly. Normalize the conversation regarding fluids, taste, and smell. It should be as natural as talking about what you want for dinner. Test together. Make health screenings a routine ritual. Doing this twice a year ensures that both of you can relax completely. Prioritize hygiene. Proper hydration and a simple shower before intimacy can alleviate many of the common worries about scent and taste. Lead with compassion. Treat any changes in the body as something you face together as a unit, rather than a problem she has to solve alone. Remember that for many women, the act of their partner swallowing their fluids feels like the ultimate form of physical and emotional acceptance. It signals that you are not just there for the act, but that you truly desire every part of her. Gentlemen, please listen to me carefully. You are never too old for passion. Your desire for connection does not have to retire, and your capacity for trust does not have an expiration date. Love and intimacy, when handled with care and knowledge, only grow richer with time. If you have been carrying quiet fears or old embarrassments about this topic, I want you to let them go right now. You are not strange for having these questions. Thousands of men share the exact same concerns. When you approach your partner with wisdom, respect, and a spirit of acceptance, you are doing more than just protecting your physical health. You are nurturing a deep emotional connection that sustains a relationship for decades. That is what makes intimacy joyful at every single stage of life. So, is it safe to swallow vaginal fluids for healthy, infection-free couples? The medical answer is a resounding yes. Is variation in the experience normal? Absolutely. The real secret to a viral level of connection is not found in a textbook. It is found in your willingness to lead with communication and compassion. If you found this conversation helpful and refreshing, please give this video a like so the algorithm can share it with more men who need this guidance. Subscribe to the channel as I release new evidence-based advice on men's health and vitality every single week. Always remember that your age is not the end of your vitality. Every small, wise change you make in your habits and in how you treat your partner brings back a sense of freedom and joy. I am Dr. Ava, and I want to remind you that your health is your confidence, and your confidence is your connection. Passion has no expiration date. Take care of yourselves, and I will see you in the next video.